Today we're going to be talking about dry needling. What is dry needling and how effective is it really? Now, first of all, dry needling in simple terms is the insertion of a very thin monofilament needle intramuscularly. So we are inserting the needle into the muscle to try relieve tension and pain by looking for trigger points. So often you'll experience this as some form of twitch response. Secondly, is it effective? In short, the answer is yes, but this obviously depends on case-to-case situations and from patient to patient. When we're dealing with acute bouts of pain, so for example, if someone has woken up with neck pain or lower back pain from sleeping in a poor position, we might see immediate effect with dry needling in terms of relieving that pain or that tension. Now, more chronic related injuries might require some form of dry needling in combination with other forms of physiotherapy treatment. So this might include some type of myofascial release, like a massage, in combination with exercise rehab. Now, when looking at the research or the literature in determining how effective dry needling is, this is fairly inconclusive. Unfortunately, within this field, it is quite hard to determine if something is 100% effective or not. Whilst the literature is obviously important to always go back to in order to form your reasoning for a treatment plan, there are limitations within research studies. So we have to look at things like the population size, the duration of the study. When we're dealing with pain, there's going to be a lot of subjective data, meaning that for some people we might see immediate pain relief, and that's determined by how they feel after the session, and for some people they might not see that pain relief. So it is quite hard to determine from a subjective point of view how effective it really is. We can also determine how effective it is from experience of working with dry needling. Now, personally, for me, being on the receiving end of it, I see benefit behind it, as well as from the side of the practitioner, I see good response from my patients with dry needling. But as I said earlier on, we don't tend to treat it in isolation. So we might do some dry needling early on to create some form of desensitization, to relieve tension or pain, promote some micro-trauma to the area where there might be pain or there might be muscle tightness. And this will give us that short-term window in order to allow the patient to get into some form of corrective exercise or movements they might not be able to do when they're in a large amount of pain or when they're in a lot of pain, for example.